Hello everyone, I'm Nivedita Khire from Patel College of Physiotherapy, currently in second year. Today I would like to share some information about clinical examination of cranial nerves. So cranial nerves are 12 olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, accessory and hypoglossal. So cranial nerves should be examined systematically in a sequential manner. Among these 12 nerves, today I will be showing how to examine third, fourth and sixth cranial nerve. The 3, 4 and 6th cranial nerve. Third, that is oculomotor nerve, has two fibers, somatic fibers and parasympathetic fibers. Parasympathetic fibers of oculomotor nerve are examined with the general examination of the eye and pupillary reflexes. And the somatic fibers of the oculomotor nerve are examined with the trochlear and abducent nerve. For the examination, we will follow a procedure which has 4 steps. The first step is observation. We will observe the patient's eyes and note that there is no ptosis, squint or nystagmus. So in this subject, there is nothing present. For the second step is examination of the ocular movements of the eye. For ocular movements, I will ask subject to place his one hand over the eye. Place your hand over the eye. So covering one eye, we will keep his one eye open. I'll place one of my hand over his head so that subject do not move his head. Then I'll place one of my finger in front of his eyes at the distance of 1 meter. Then we have to move a finger from left to right, upward and downward, and all 4 oblique directions. So my observation is that the subject is able to move and follow the movement of my finger with his eye. This shows that there is no eye lagging behind or there is no squint present. Same procedure will follow on the other eye to check the intactness. So please place your hand, follow the movement of my finger. So my observation is both his eyes. The third step is examination of the conjugate deviation. For the examination of conjugate deviation, we will follow the same procedure as the second one. Just I'll keep both his eyes open. So keep your both eyes open and focus on the finger and follow the movement of my finger. So my observation is both his eyes are following the movement of my finger. If there is presence of a paralytic squint or any disorder, then one of the eye or both the eyes will lack in following the movement. Along with the conjugate deviation, the third step also has the examination of concomitant strabismus. For examination of concomitant strabismus, I'll ask subject to keep both one of his eye covered. Please cover one of your eye. Now I'll place my finger in front of his eyes and I'll ask subject to uncover his eye, uncover your eye and focus on my finger. So the second eye of the patient also focused on the finger. So my observation is that concomitant strabismus is not found. Now the fourth and the last step, that is examination of convergence. For convergence, I'll ask patient to look far away. Look at that window present there. Now I'll place my finger in front of his eyes. Now both his eyes tried to look at the finger and none of the eye was lagging. So my observation is that his eye muscles are working properly and are intact. Thank you.